Back, my fellow YouTube subscribers, subscribing nurses, subscribing moms, subscribing everybody, especially in the nursing field. I want to say thank you for everything and hooking it up with the comments and all that good loving that I've been receiving. So I appreciate it, guys. First off, I want to start off with all my subscribers. How you guys doing out there? Honestly, how was the first semester for all the nursing students? I want to know. Leave your comments, and I want to know what's going on with you guys. What's the struggles you guys are kind of, receiving, and what's going on, and what do you guys lacking of? I want to know in your own words, because you guys ask me questions. I want to ask you guys a question. How's things going? Is it getting harder? Is it getting easy? Is the semester cool? Is there backstabbing nurses out there? You never know. You never know. So just be careful and do what you need to do to pass. But I want to know in your own words, guys, like what's the struggles you guys are enduring right now for the first couple weeks of nursing school. It could be the exams, the head-to-toe assessments. It could be the medications, the PCRs, which is patient care reviews. The papers that you guys write, which takes all night. And I know how it is. I've been through it. I know how it goes. But leave a note. Leave the notes, guys. Leave the comments and all that good stuff down here. So first, let's talk about some questions I got from a couple of you guys. I'm going to answer, just kind of go through all of them. One I got is, do you know any free site that can help you review for the NCLEX? Yes, I do. And the best one to go to is, actually I marked it on the side, is www.testpreview.com. Now that goes through everything. Goes through endocrine, musculoskeletal, cardiopulmonary, whatever system you're learning, go through that so you'd be ready for your exam. Another thing too is it breaks down everything, even psych, when you start getting the psych rotation for your nursing school. So check that out. Much love to whoever sent that question. Now check that out, guys. It honestly helped me out for NCLEX and for application style questions that you guys go through in your questions for your test. So check that out. Here's another question I got. I'm currently in the Psych Tech Program. Which Psych Tech school did you go to, California? Can you make a video on Psych Tech Program? Well, you know what? Here's part of the video. The Psych Tech that I went to was, it's just called Psych Tech Program. And I'm not going to drop the name of my school, but they were pretty good. They were well balanced. They were just on top of their game. They were professional. And it's more psych. It's not physical needs such as nursing, but the comfort needs for a mental problem, for a mental issue, for a psych issue, for a dual diagnosis kind of patient. So I could further explain that, but that's going to be in another video. We learn about everything: type A, type B, type C personalities. You got schizoaffective, schizophrenic. Then you have borderline narcissistic, histrionic. Then you have antisocial behavior. You also have OCD, ADD, which I got ADD. But you got all these types of personalities and mental disorders that people don't realize that people have. It's funny because when you start going through it, at the very end of the day, when you're done with school, you start realizing, oh, that's why my instructor is hard like that. She thinks she's narcissistic. Just kidding, whoever's listening to this. But you really do feel like that. And then you see someone, oh man, why are they crying the next day and happy one day? Oh, they have bipolar. Or, oh hey, why is this person not able to pay attention? Okay, he has ADHD, attention deficit hyperactivity disorder. So it's hard. Like you start, seeing what people actually really have, and it's funny because it's a good way to understand people. It's awesome. I love it. I liked it. And Psych Tech, I haven't used it for almost a year now, but I'm loving the whole mental part of it, and it's important for all the nurses who go through that. You really have to know what's going on. You can take care of a patient, give meds, walk away, but if they start crying, you need to know what's going on. You need to understand what they're going through. Emotional distress, they're going through the grievance of someone, a loss of a family member. A lot of stuff we don't pay attention to, but it's important because everybody can go through a mental problem just like that with the death of a family loss or anything. Anyway, let's go. Can we keep going? Is that cool with you guys? Because I'm trying to make this short and sweet and hard to beat. Next part. I have another question. Says ADN versus BSN. Now that you're in the workforce, do you see the difference? By the way, a person is with an ADN and BSN, and which ones are employers hiring the most? That's a very good question. Now, what I think is associates, just because we're more hands-on, we're more in the clinical field and the setting, we're doing all these lab and everything we didn't understand, so it's important for the associates with the degree to go through the hands-on part, the technical part. Now don't get me wrong, for the BSN they go through theory and do clinical, but their more increased knowledge is in theory. So when you ask them something, they'll know it like that. I mean, but associates, we have to know it too, because we go through the same state boards with someone with a diploma, with an associate, with an a BSN degree in nursing. It all goes through the same. So in order to pass the NCLEX, you just need the knowledge that a BSN has, that an ADN has, and also a diploma nurse has. So regardless of what setting and what background education you have, you need that to pass your NCLEX. It doesn't matter. But in my personal opinion, I think they're hiring more associate where I live. Now in other places they need probably BSN. You have open opportunities with BSN, but it's always good to continue education. So next question. Can we hit the next question? Alright, let's do it. Please tell us about your OB clinical experiences. Woo-wee! I don't know if I can share that with you guys, but let me just tell you, being a male in the OB clinical was tough, but it's doable. I mean, I had to, check the fundus, and you guys know all that stuff. I'm not going to break it down, but it's funny because I had to be there, and I have to get checked off on my list what I do. So there's one incident that I had that every time I try to go in and do my assessment for someone who's pregnant, and she's like, I think their husband will always be in there. So it made it hard because I couldn't do an assessment. He'd be looking at me all funky, but you have to do it professional. You're not trying to, do anything that you wouldn't do. It's professional. It's part of a checkoff list. It's what you need to do to pass the clinical. But it's hard because you're a male and 98% of it are all females. So when you're actually in there, it's like, what's going on? What's the deal? And you have to ask them. You always, if you do an assessment with a female, always have someone with you for a male's sake. Just because they could turn around and flip it. So you always have to say, hey, I'm here doing my assessment. And never, ever, ever, ever be inappropriate. There's no room for that. And for being a professional nurse, you have to make sure you bring your A game and always tell them, hey, look, my name is so-and-so. I'm a registered nurse. I'm going to finish and do an assessment for the doctor to know what's going on. That's it. Now, you can ask them, do you feel okay with me doing this? And if they say no, that's fine. Or we'll get you another nurse. But it was hard for me. I had my instructor with me all the time, and every time I went in there, all the husbands were like, nope, I don't want this guy doing this to my wife. Another one, nope, I don't want it. So after 4 tries, I finally had one that was actually really cool, down to earth, and then I did my assessment. I checked everything around the perineum area, and of course, my instructor was with me, but that was probably the hardest thing. That's a good question, and I know why you asked me that, because I'm a male, and it's hard for males to actually do an assessment with a female who is an OB. So I understand that, but yeah, it was hard. It was cool to actually do it, and yeah. So let's go to the next question, because I don't want to talk too much into that. What do you want to do with your abilities? You have the chance to make a big impact in the world that you live. I can see you being contained with your skills and motivation, so that's why I'm asking, what would you like to do as a nurse? Easy. ER, that's where I want to go. I want to go in the emergency unit. And to talk about on that note, I had an interview about 2 weeks ago, and out of 30 applicants, that's a lot of applicants, so I went in there, dressed professional, looked all nice. And words of advice, guys, when you guys go in there for an interview, don't wear a scrub. I mean, you got to go in there wear professional clothes, because it's a professional job. Don't just say, hey, I got off for work. I had the opportunity to do that, but you got to change with the quickness, and look professional. So ER is where I want to go. It did get filled, but there's always opportunities, and I'm striving. I'm gonna keep going until I just can't go no more, until these lungs can't push me to go no more. Why? Because I want this job. So I'm gonna keep doing it until the job's filled, and if it gets filled again, reapply. It's not a big deal. So that's another question I got. Let me see what other questions I have. Let's see. Well, those are most of the questions that I wanted to go through with you guys. Hopefully that answers most of them right there. If you guys have any more, you guys let me know. I'm trying to figure out if there's any other. Oh, don't forget, guys, comment on the bottom what you guys are struggling, what's your guys' problems you guys are enduring right now while in your nursing clinicals or setting or your hospital field or whatever. I want to know, because I'm always answering your questions. Answer one of my questions, guys. Alright, guys, on that note, you guys have a good night, good evening, good morning, and a good afternoon. I'm out. Thank you, my fellow YouTube subscribers. Hit me up. You guys have a wonderful night. Peace.